I now have the real honor to be able to introduce Heather Bresch. Heather is the CEO of Mylan NV and the chair of the GPhA Board of Directors. Heather has established herself both in terms of business and executive leadership as setting an incredibly high standard for others to try and live up to. She is the CEO, as I said, of Mylan, one of the world's leading pharmaceutical companies, and she also serves on the Mylan Board of Directors. Heather has been with Mylan for 24 years and has held roles of increasing responsibility in more than 15 different functional areas and played a key leadership role in a series of large transformative acquisitions that more than doubled Mylan's size. She is now leading Mylan into the next chapter of sustainable growth, which is expected to significantly expand the size and scope of the company. And in achieving the company's goals, Heather is aligning employees behind Mylan's mission to deliver high-quality medicines to people the world over and create a better health care for a better world. She emphasizes a collaborative culture focusing on leading, learning, teaching, and performing. As we all know, she has been a key industry leader on initiatives aimed at removing barriers of access to medicine. She was particularly instrumental in the development, design, and enactment of GDUFA 1. And also, Heather previously chaired GPhA, which is an experience that will immensely benefit us as we move forward over the next several years. She was the first, and she is the first to serve now as a third time the chair of GPhA. So Heather, on behalf of all of us here, welcome back and welcome to the stage.
After hearing that introduction, but I greatly appreciate it and am very honored to be back. Some would say I've never left. As many of you know, I do feel rather passionate about our industry and about truly providing people access to high-quality health care. And as easy as that sounds, and as compassionate as it sounds, all of you know how difficult that really is to accomplish. And as we look at our world today and the globalization of everything around us, our industry, the interdependencies between everything from Wall Street to China to pharmaceuticals to healthcare to oil, I mean, some of the things that affect the movements, whether they're in stock prices or they're in valuations of companies, is all interdependent on what has become an extremely global economy. And as I think about where GPhA is today and what we face as an association, it's truly continuing the march of globalization. And I want to thank Chip for his leadership so far. He came into this role seamlessly. He certainly had the benefit of understanding the industry as a whole, but I think his embracing, understanding, and wanting to take this association, amplify our voice in Washington, is an ambitious goal, and it's one that takes tireless effort. And so I would first like us to give Chip a big warm welcome and hopefully give him much energy for the job at hand. I would also like to thank Craig Wheeler and the board. You know, these jobs can sometimes be thankless. There's a lot of administrative work on top of, you know, everyone's day jobs. And so I think that as we think about the companies and the membership and the leadership that has stepped up, I can't thank enough. Every year we face different challenges, different opportunities, and it's about seizing those. And that really takes being present and on the field. You know, if you're playing and you're only talking in the stands, you can't have much effect of what's happening on the field during the game. And I think that what has invigorated me to be fortunate to take this position again, I can't believe it's been over a decade since the last time I served as chair, is truly these challenges. They're large ones, they're difficult, they're complex. and it requires teamwork. No one person can fix the issues at hand, no one company, no one voice. It's truly unifying and coming together as a team that's going to allow us to continue this fight. So Craig, again, I want to thank you and the board for all of the work you've done over the last couple of years. So I'd like to just take a couple of minutes. Chip certainly did a great job reflecting on everything that we face as an industry, everything that has, come our way, whether it's been very ad hoc or instantaneous, or issues that we have fought for years as an industry. And if I stick with the idea of global, our global evolution, I really think about it in three buckets. The industry, companies have globalized for years. Hatch-Waxman back in 1984 certainly served as an accelerant of people understanding how to enter this country, how to do business in this country, how generics would play a part, how we would try to balance innovation and competition really better than any other company in the world has proven to do. And so with that came many changes around the companies we're competing with. It wasn't until about 2012 and really GDPhA and passing a law that would recognize that all products sold in the US needed to be held by the same standard. And again, perhaps as simple as that sounds, our FDA had not been equipped, had not been resourced, or did not have the standing to really implement that action. So as we fought for changing the 1938 law that would make sure that we would transform, the agency needed to transform from being a domestic one to a global one, and having the resources to do so. With that being said, and as I said, as a huge advocate to make that happen, because I don't know what our alternative was. I certainly don't believe having unsafe or ineffective medicine being dispensed here in the US is an answer. I believe that we do have a world stage here in the United States, and it's up to us to continue to raise that bar of quality around the world. And so if organizations, if companies are forced to meet that bar, to surpass that bar here in the US, we know that it brings good to their domestic environment in raising that bar of quality. But with all that being said, we need to make sure it works. I know that everybody in here has had their share of pain through these transformations. Making sure that we get through the backlog, that we can address safety, access, and transparency when it comes to what the FDA's mission statement is an ambitious goal. And yes, we knew they needed resources. Yes, we knew we needed to change the law, and we've done those things. But we need to now have a gut check about, is it working? And there's things that we need to absolutely make sure that is working in GDPhA 1 before we can contemplate what GDPhA 2 needs to look like. And so I assure you that we will continue to work very, very hard, very focused, and hopefully very effective and efficient to make sure that we do provide safety, access, and transparency around the drugs, the approval process, the inspections, and most of all, getting medicine into the hands of the people who need it. Lastly, this association. As I think about when I was chair back in 2004, 2005, we certainly were facing global issues. There were trade issues, but the fevered pitch of the globalization has gone to a whole nother level, exponentially has changed how we do business, where we do business, and the association has got to try to step up and serve that role. And so we've had a lot of discussion. We had discussion yesterday in the board meeting that we should even contemplate rebranding GPhA. We need to make sure that it's inclusive of everything we represent. There's not just these black and white lines of a generic company, a specialty company, brand company, biosimilar, biologics. There's a lot of blurring of the lines because companies from the hyper-consolidation in the healthcare system to both on a vertical level and a horizontal level. Our customers are continuing to consolidate. They're continuing to consolidate. Like I said, on a horizontal basis as well as a vertical basis. So as this continues, the association needs to make sure that we're inclusive of that. So we've had a lot of discussion that we should do some work around making sure that we represent embracing who we are today. And, you know, I think we've seen that happen throughout other industries and associations to make sure that when we speak, and we speak with that unified voice and amplifying that voice, that it's very clear about what our mandate is and who we represent. You know, I don't, again, need to speak to you about our challenges. I think they're very clear and obvious that there are many, many peers, many other associations, many other organizations that are fighting a lot of different causes. And a lot of them have louder voices than us. But if I think back again to our roots and our founding fathers and mothers that thought about how important it was for generics to have a voice, to have a place. When you look at what we've become in the healthcare system today, it obviously worked. When you look at what we represent, those challenges were overcome. And today, we have different challenges, but that doesn't mean they're any less heroic of continuing to provide access to affordable medicine. So the challenge from a political, economic, legislative, regulatory, all of these issues, and again, not just even here in our own backyard, but globally. And as we were talking about yesterday, even if you're just US-based company, you're still competing globally, because the reality is everyone you're doing business against with, or many that you're doing business with here in the United States, are global. So needing to make sure that the level playing field, how we're doing business, and setting that standard is important for every single company doing business here in the United States, and likewise throughout other countries of the world. But things like TPP, you know, Chip mentioned, this has been a long, hard fight, and certainly we started in a very bad position with really access being at the root of no access for affordable pharmaceuticals. And we were able to move that bar, certainly not make it perfect, and certainly not have access everywhere that it's needed around the world, but our voice was heard, and we made a difference. How that and where that ends up, but being able to position ourselves to fight these fights take just that. It takes engagement. It's going to take all of us really looking to step up. And as we talk about the opportunity, and as I said, we have faced these challenges before, which have led us to now represent 88% of all prescriptions. As Chip said, almost 9 out of 10 prescriptions filled are with generics, yet we're only 28% of the total drug cost. These are numbers you know, and unfortunately, a lot of this gets lost in being painted with a brush of pharmaceuticals and people's thoughts and perceptions around drug cost. You look at the savings that we've created over the last year and the last decade. I mean, truly, we are the backbone of this healthcare, of what we're able to deliver as a country for healthcare. And we really set the standard to be a model for the rest of the world. Yet sometimes we don't recognize how complicated. While we're the best, and we may believe that we deliver and have the most innovation, and the idea of making sure that we're balancing innovation and competition has never been more important. It also needs to be recognized that we probably have one of the most complex systems, if not the most complex payer system in the world. And a lot of times it can be lost that there's making the product and there's taking the product. And people forget that in our country there's 4 or 5 steps in between making the product and taking the product. And those handoffs each and every time come with playing a part of the chain, the supply chain, and play a part of the cost of that product. So as we think about what we represent and the fact that we truly are driving savings, not cost, the onus, unfortunately, is on us to show that in a very streamlined, effective, and efficient manner. We can't shy away from the price discussion. We can't shy away from the fact that the argument of, well, we really don't set prices. It really is education, and it's not allowing other people to tell our story and being painted with that brush of all pharmaceutical companies are bad. All pharmaceutical companies making money are bad. We all know how ridiculous that is, but these PR, the headlines, the rhetoric can catch a lot of momentum. And I think we've witnessed that this fall and coming into this year about how far rhetoric can get you. And it can get you pretty far in this day and age between media, social media, news 24/7. So our jobs are that much harder to amplify our voice in a very, very noisy platform. And I think that we do that with facts and figures. We do that, again, by being together and delivering a very consistent message. And it's not about any one product or taking a snapshot of a product or not only just one product, one company. This idea of isolating a single event versus looking at the holistic framework is what the real heavy lift is. And we can talk about taxes in the same way. It's easy to have sound bites and rhetoric around taxes. It's a much harder job to change the U.S. tax code. We can have sound bites and rhetoric around healthcare. It's a much more heavy lift to fix the system. And so I can assure you that I believe that we can do a lot together to continue to help educate, to build allies, to have advocacy, because it's undeniable what we represent and what this healthcare system would look like without us. And I think that, we're on the precipice of biosimilars in that same way. The value and what needs to be created around biosimilars is the exact same as we had in small molecules back in the 80s. I think before Hatch-Waxman went in, generic utilization was 15%, and it took decades for us to get that right, to get that innovation and competition balanced. Always not perfect, and there's a constant evolution of legislation and litigation, and as we all know too well, how we end up interpreting laws. But the reality is that this is the area where we need to be focused, that we can deliver the same kind of backbone to the healthcare that we can continue to deliver in this country as our country has gotten used to. And I think the other thing that's sometimes we short sell ourselves on is what we represent in this wave of biosimilar development. I mean, when you look at what member companies, when you put our investments together, more than $15 billion, that is not a small number. So when you look at what we represent as a group of what is going to be coming over the next 10, 20 years, from specialty pharmaceuticals to the cost of healthcare to the cost of actually delivering healthcare, again, we represent a solution, certainly not the problem of our system or how it works today. And I thought it was important just to put our mission back up. I think our mission is very clear. I think that our mission says a lot about what we've been able to accomplish over the last 20, 30 years. I mean, we have come a very, very long way. We have been able to truly fight for access. We've broken down barriers. We've provided products. We're able to really show how important this organization and how important all the member companies and how important the evolution of all of our companies to continue to grow and thrive is ultimately important. I think it's easy to look, again, at the low-hanging fruit or talk about drug manufacturers because it's the easiest thing to point to. Like I said, all the middleman in between, it's very difficult, and that lack of transparency in the system and how our system has been evolved over time has just gotten more or less transparent, not more transparent. So I think it's important for us to remember why we're all here and what we're fighting for and what's important. And yes, it's okay to make money. We want companies to be profitable. If you're not profitable, you're not going to stay in business very long. But it's a way of showing that balancing act of what we're doing and how we are making a difference and why we need to, like I said, thrive and be able to continue to deliver on this mission statement. And again, that's not any one person. It's not GPhA staff. It's not any one company. It's truly all of us coming together to deliver on providing this access. And as Chip mentioned, there's a lot of different agendas. Companies can have differing opinions, but we have plenty to align behind. There's not a lack of issues. There's not a lack of challenges that we face out there. And there's certainly not a lack of things that we can rally behind as a unified voice. I think lastly, a call to action. I would say that to execute on all of these things. We talked a lot about strategy, and I think that Chip and the staff have done a great job of laying out really that strategic plan. But we know execution eats strategy for lunch all day long. You've got to be able to execute. And I think to execute, again, is going to require us stepping up and getting more engaged. And I am going to ask that the leadership of companies really step up. It can't be delegated. You can't delegate the leadership that's needed at this very, very critical time in our industry. We need, yes, we're going to have to look at our due structure, and we've got to pay more, because you look at what we're up against, again, to have a voice, to be able to have a seat at the table, we're never going to compete. I think pharma's budget is over $200 million a year. Ours is 16. So I'm not suggesting that we're trying to fill that gap. What I am suggesting is that there's got to be a combination of financial resources, but at the end of the day, people make a difference. We are where we are today because people have cared, have been passionate about this industry, have been passionate about making a difference, and that all day long has trumped the dollars, the lobbying. But we need that to continue, and we need more of it, because the issues haven't become smaller, they've become greater, they've become more complex, they've become bigger, and it requires more passion, more caring to really move the needle on making stuff happen. So educating, getting new members on board, I can certainly tell you I will do my part of reaching out to leadership across all of our member companies, companies that should be member companies, and continue to hopefully rally all of us, because like I said, we face a lot that's happening in the system. We don't know who the next administration is going to be, what kind of issues they're going to try to tackle, but I can assure you healthcare will be front and center. It has to be by necessity. You look at what this country is spending, $3 trillion, and you look at the inefficiency in it, and the fact that we represent 2% of that $3 trillion cost, yet we're providing 88% of the pharmaceuticals delivered. Somehow in all of that message and story, we need to find our way that allows people to really recognize what we stand for, what we're here to do, and to help us do more of it. And that's why partnering with FDA, figuring out the challenges around transparency and getting our products approved, that ties ultimately to the cost of products, to the drug shortages we see. Sometimes I say, sometimes products were just too cheap. I know nobody wants to hear that, and that's not the popular, that's not a good PR soundbite. But the reality is, you look at the complexity around manufacturing, injectables, sterile injectables, the sophistication of drug deliveries, and if you expect to get that less than a cup of coffee, I think we should ask ourselves what really standard and quality of care that we're looking for. So again, I don't think it's things to shy away from, but I think the onus is on us to educate, to tell our story, and it's going to take all of us to do that. And not only does this association need that to happen, our country needs you to make that happen. So with that, I can't thank you enough. I look forward to working with all of you, and it's going to be an interesting year.